What do you do when you've had a stroke or a brain injury and you've been getting home health and they tell you, okay, home health is going to end? What is the next step? Maybe you don't feel like you're ready. Maybe you feel like you're just not done with your recovery, and so you still want to get home health. I totally get it. I understand. Home health is really geared more towards making sure that you're safe at home and the transition from the hospital to home is safe, and that you don't go back to the hospital because you're not supported at home. So that's kind of what the focus of home health is. When home health gets ready to discharge you, that doesn't mean that you're done with your rehab journey at all. It just means, just like you were discharged from the hospital, when you're done with that level of care, you're going to be discharged from home health when you're ready for the next level of care. So you had the hospital, you might have gone to skilled nursing, then go to home health, right? These are all just kind of like different levels of the care spectrum. And so the last one is outpatient therapy. And if, you're discharged from home health and you're like, I really don't feel like I can make it out, or it's really like, I feel like therapy would just be better in my home. You're in luck. There's a new movement. It's been around for a few years now, where there's a lot of outpatient therapy providers that are willing to go in home. I'm not sure about in more rural areas, but definitely in more metropolitan areas, you can probably find somebody to come to you that is at the outpatient level. And that would even take Medicare. So that's really great. That's a great option for you. And for speech therapy, for me and my company, if we can't make it in home, because let's say they're 30, 45 minutes away, and we don't always have that kind of drive time available, then Zoom is a fantastic option. We can do so much with teletherapy these days, and we are so comfortable with it now that all you have to do is be able to see the screen and hear us. And we take care of the rest. It's fantastic. We can pull up all kinds of different worksheets. We have apps, we have websites. There's so much that we can do, even on the whiteboard, even just talking out loud. There's so much we can do, and the therapy is so great on Zoom that it's a really good option if you have the capability at home.